Hello there, welcome to the program. I'm Jane Mutoni. The 2019-2020 Rwanda Demographic and Health Survey found that infant mortality rates during childbirth and for toddlers below the age of 5 has reduced to 45 for every 1,000, down from as high as 196 for every 1,000 back in the year of 2000. A general census is to be conducted this year countrywide with the use of technology. A very warm welcome to the news in details now. The 2019-2020 Rwanda Demographic and Health Survey found that infant mortality rates during childbirth and for toddlers below the age of 5 has reduced to 45 for every 1,000, down from as high as 196 for every 1,000 back in the year of 2000. Health officials in the country note that healthcare workers at the local level have been very instrumental in making this possible.
The survey also noted that the figure had reduced to 76 per 1,000 in the year 2010, and that infants that die within the first 30 days of being born reduced from 44 per 1,000 to 19, while the death of children below the age of 15 reduced from 107 to 33 per 1,000.
When we women realize we are pregnant, we go to the hospital at the earliest opportunity, and when labor begins, it is wise not to waste time and go to the experts so that they can help you, lest complications develop for yourself and your baby. I brought my baby for immunization, and that begins soon after the child is born, and there is regular follow-up afterwards.
Officials at the Rwanda Biomedical Center note that the improvement is the result of major changes at the local level, though much more still needs to be done. There has been more availability of the equipment we need to make this possible, and innovation has been part of the process to bring healthcare closer to local communities through people like health workers who do follow up on the children and help health centers to monitor expectant mothers. We are therefore expected to continue with such efforts because it is not uncommon for good progress to be made, only for a backsliding to occur. That is why we must persist in this and make sure that communities have access to healthcare. Rwanda has given herself the goal of reducing the number of infants who die within the first month of being born to less than 15.2 per 1,000 by the year 2024 and less than 12 per 1,000 by 2030. Health experts are confident the targets will be met. We are confident because the number of doctors has been increasing, especially specialists. It used to be that doctors would be put up in hotels to attend training, and now specialists find those doctors in their natural working environment to show them how things are done. Local communities now have health insurance, and people seek medical services in hospitals. As the country continues to develop, so do such services. The 2019-2020 Rwanda Demographic and Health Survey also found that 96% of toddlers get vaccinated and 99% of expectant mothers go for checkups at least once during their pregnancy. 93% eventually give birth at health centers and hospitals. All of that has helped to significantly reduce infant and maternal mortality rates during birth.
The Biomedical Center has noted that the use of technology in various activities has significantly reduced the spread of COVID-19 and that it assists them in gathering information that is useful for the country in the decision-making process on the preventive measures progressively being adopted. Olive Nete reports.
The science room at the Rwanda Biomedical Center is used to gather data and analyze all information about health. Mohamed Semakula, a health scientific innovation analyst at RBC, explains how data is analyzed by specifically using the case of COVID-19 pandemic.
We usually look at the cases we have, if they are from within the country or abroad. We closely examine the relationship between the cases and their influences, and this provides information that helps in making decisions over travelers. And people also use our link to access results, and we have been using this technology so that people can be served.
Since the COVID-19 virus was first detected in Rwanda in March 2020, technology has been useful to health authorities to measure the relevant information and also closely monitor patients to help mitigate the spread of the pandemic. The head of the HIV and AIDS Disease Prevention and Control, Dr. Albert Tuyishime, has noted that the use of technology allows them to take action and monitor all activities based on the data collected.
I can name the screens that are there to help us monitor the temperature for everyone incoming, especially for travelers. But also we use robots to help us, again, monitor the temperature, but also in some of the infection prevention and control activities we had at that level. Secondly, we use technology in the testing or diagnosis of the COVID-19, whereby we have a system that is helping us collecting information and data for everyone who is tested. And from there, we can generate automatically a certificate to anyone who has been tested. So this allows us to have the data, but also consolidated information on people we are testing. Moving to the case management, we have two categories of patients. We have those who are at home, what we are calling home-based care. We have a system we are calling Welter system that is helping us communicate in real time with them so that we can know if they are developing symptoms or severe symptoms so that they can be supported immediately.
Regularly evolving technology has become an important part of people's lives, and they are getting used to it in no time. In fighting against the spread of the pandemic, a system has been put in place where people use the Irembo website to apply for different documents, and there is also various delivery services currently being used in buying and selling to avoid gatherings and paying in cash that may lead to the spread of the virus. People used to go to different local authorities for different services, but by using this website, they get access easily. This has helped in fighting against the spread of COVID-19. Comparing the number of people we started with and those we have today, there is an increase of 80%. Even though the numbers of infected people has raised, it has not affected our services. This means that people now understand the importance of such services, and we hope that even after this pandemic, people will continue to use our services. The head of Department of HIV and AIDS, Disease Prevention and Control, Dr. Albert Tuyishime, also points out that using this technology has been helpful in managing and dealing with this pandemic.
These technologies did help us in terms of having information in real time so that we can have informed decisions. That's one. Secondly, these technologies helped us to communicate with the general population, but also with other partners as well as the world in general, which are really key when you are dealing with a pandemic such as this COVID-19.
Besides using technology in testing and analyzing COVID-19 cases among local residents and people from outside the country, RBC also has a system where you can use *114# to access information on vaccination status as well as testing. Olive Nete, reporting for RTV News.
Thank you, Olive, for that report. Now, a general census is to be conducted this year countrywide. Citizens and various institutions say that having an accurate number of the country's population along with their livelihoods helps in making a stable budget plan. The National Institute of Statistics of Rwanda says they have made efforts to use technology in the census. Take a look. Preparations for the 5th General Census of Population and Housing is expected to be completed by August this year. A preliminary census was conducted in which a test was done on the population in selected villages. Residents say that they are aware of how important the General Census is and understand how it is conducted, both in terms of national budget planning and in the fight against poverty.
This population census is important in terms of knowing the accurate number of the Rwandan population in order for the proper national budget plan to be made. When we go back in history, the number of Rwandans have always increased, and yet the land they live and cultivate on does not, which is why after a certain period of time, a population census has to be carried out in order to monitor how much the population is increasing and advise the citizens on the proper measures to take.
Local authorities and other government institutions believe that having a real picture of people's livelihoods and housing helps them to know where to invest in a way that impacts the development of the people and the country as a whole.
We shall be able to reach to people with disabilities, and as they answer these questions, it will help us determine the number of people with disabilities nationwide, the kinds of disabilities, and also more information on their well-being, as well as their social categories known as the Ubudehe categories. This will help us to make a budget plan for them. Other national institutions will also need these statistics, as they shall be reliable and accurately conducted. Through statistics, we are able to know the level of poverty. This census will show us where it has reached. We hope that it will be low because there is so much we've achieved here in Nyamasheke district as we depend on agriculture. We are looking forward to the outcomes of this census, and we hope it will be impressive in terms of development.
The 5th General Census of Population and Housing is scheduled to take place from August 16th to 30th, 2022. The National Institute of Statistics of Rwanda says preparations are nearing completion, and they are now in the process of selecting census clerks. Of the 63,000 primary school teachers who applied for the job, 28,000 will be selected. Habarugira Venant, the director of the Census Department at the National Institute of Statistics of Rwanda, says they have made efforts to use technology in this 5th census, different from the previous ones.
Before we used data sheets when collecting data, and after they reach the data center, it would take 6 months to process the data on the computer. And it took another period of time to process the data electronically to extract the data, which is the outcome. It would take so long. But now we have given ourselves a timeline of 2 to 3 months to have collected the basic data, so that in December we will have provided the data, which otherwise wouldn't be possible when using papers, considering the time it takes to copy the information from paper to a computer.
The statistics from the 4th Census of Population and Housing, which was conducted in 2012, are still being used up to date. It was estimated that there are 10,515,973 people in Rwanda, including 5,064,868 males and 5,451,105 females. The city of Kigali had a population of 1,132,686. The southern province had a population of 2,589,975. The northern province had 1,726,370, while the Western Province had a population of 2,471,239, and the Eastern Province had a population of 2,595,703. So far in Rwanda, the population and housing census has been conducted in 1978, 1991, in 2002, and most recently in 2012. Visually impaired people wish to have more writing styles in Braille in order to also generate more knowledge, including the Kinyarwanda language, because only the French and English languages are found in Braille, yet there are those that do not speak those languages. Shislene Mgwaneza reports.
Masaka Resource Center for the Blind is an institution that aims at providing rehabilitation training for persons with visual impairments between the age of 16 and 50. It helps people who lost their sight to learn Braille. Jean-Marie Vianney Micheshimana is the head of this rehabilitation center. He says that he made this step after learning how to write by using Braille machine.
This means that Braille is the key that leads to technology, because you can't use technology without first being familiar with Braille. Braille is the primary knowledge and technology is secondary, because yes, we are developing, but our development is based on Braille. And you all know that no one can progress without education, and for the visually impaired, they can only access education through Braille. This means that all of these people you see in professions, those who completed universities, the key to their success is learning how to use Braille.
Urufunguzo rwabyo ni Braille bizi.
Other visually impaired people also say that Braille writing style should also be considered and included in all activities that aim at developing the country.
The challenge is that it's not found everywhere. So like maybe they don't know that it's the only writing for people with visual impairment. But I'm just here to say that when we have official gazettes, when we have any publications or any announcements, more especially for this COVID-19 pandemic, we really need to remember that there's people with visual impairment, and we have include those people with visual impairment. There's those people who just rely on Braille.
The project manager of Education for All at National Union of Disability Organization of Rwanda, William Safari, has said that they are having discussions about the issue with the Ministry of Education.
We blind people, expert in Braille, need to sit down and come up with the ideas on how in Rwanda we may have a standard Kinyarwanda Braille code, which will be used in schools as a common Braille method, so that even those books we are saying, even those reading resources may be transcribed in that common Braille that was approved by REB. So we think that maybe in this year we need to have a common Kinyarwanda Braille which will be used in the different transcriptions.
Figures from the 2019-2020 Demographic and Health Surveys report indicates that 47,245 visually impaired people were asked, and 80% of them have no challenges when it comes to using Braille. 14% have some challenges, 5% have serious challenges, and 1% do not know how to use it at all. 2.2 billion people worldwide live with disabilities, with 1 billion that are visually impaired. Shislene Mugwaneza, RTV News.
Well, there you have it. On behalf of the entire news production team, thank you for your company. I'm Jane Mutoni. Bye for now.